A patient will come to the clinic with a chronic pain problem, particularly chronic low back pain, with or without pain that radiates down the leg. They've had that pain for many, many years. They may have seen several physicians, pain physicians, spine surgeons, neurologists, and they still have pain. We looked at that into some detail, and we found that if we perform endoscopy on patients with low back pain, that often what we see on MRI or CT scan does not correlate with the findings we have on epiduroscopy on our scopes. What that means that sometimes the advice patients get to undergo some kind of surgery, for example fusion or discectomies, in our opinion is not the right one. Those patients typically do very well with epiduroscopy. We can look inside, see what indeed is going on, and if we cannot treat, we can at least advise them how they should proceed. But in many cases we can treat, and it's very often independent of what the MRI shows. We bring the patient to the operation room, make a very small incision at the tailbone. There's an opening where you can enter the spinal canal. Then we put a flexible fiber optic scope inside the spinal canal through the tailbone. Once we're inside the spinal canal, we look at the nerves, we look at the discs, but in particularly we look at certain areas where we have learned that pain is coming from. Once we found that particular spot, then we'll try to remove it. We can either use the scope to do that, or we use a procedure called the passive procedure to remove, punch out the tissue that is responsible for back pain in most patients. And sometimes I call it the hug procedure, because patients come back and they want to hug me, because they've had pain so long and suddenly it's just gone.